Georgia Colburn is a healthy 13-month-old, which is remarkable considering she was born 3 months premature last January.
Yeah, it was terrifying. We were prepared for worst case scenario.
After 110 days in the neonatal intensive care unit, Georgia was finally discharged.
Good job.
But doctors warned the Colburns that their daughter's premature lungs were vulnerable to a severe RSV infection this winter and she needed protection.
There's the RSV prophylaxis, and that one is essentially to protect infants from RSV as much as possible. We were told in the NICU that it shouldn't be an issue to have it.
When they applied to the BC government for a dose of the monoclonal antibody medication for Georgia, they were told she didn't qualify.
It's extremely disappointing that we weren't covered by BC, that BC did not have our back. I just don't understand why they're not protecting the most vulnerable members of our society, babies.
The Colburns traveled to Washington State to get Georgia a dose of the RSV protection, and they're glad they did. 2 weeks ago, she was admitted to BC Children's Hospital with a fever and difficulty breathing.
It was the doctor who informed us that she had had RSV and that it had progressed to bronchiolitis.
That doctor told the Colburns if they hadn't paid $500 US for the antibody medication in Bellingham, Georgia could have ended up in the ICU.
The injection is not going to prevent the babies from getting sick, but it's going to help them to recover faster and have a less severe illnesses.
Georgia would likely have gotten the medication if she lived in Ontario or Quebec, where it's more widely available for infants.
We are really calling for equal access to prophylaxis for all babies, because we know the impact of RSV, especially on babies who are born preterm with very immature lungs.
In a statement, the health ministry says it's following national standards about which infants are eligible for the medication.
Yay!
With help from the antibody treatment, Georgia recovered from her RSV infection. But the Colburns know not every family can travel out of country to get that medication.
And it's not fair. And so if Georgia's story can help change things in the future, that's what we want from this.